The information provided in this podcast is for general knowledge and informational purposes only. It does not constitute medical advice. Always consult with a qualified healthcare professional for diagnosis and treatment of any medical condition. The views and opinions expressed by guests are their own and do not necessarily reflect the views of the Unplugged Healthcast or Dr. Wall.
If you're not sleeping, you're not healing, you're not regenerating, you're not recovering, you're not going to actually have the ability or the energy to fix anything else.
Fix the sleep first, because the rest of it will come later. So
no,
if you're not restoring the brain, which restores the cardiovascular system, the metabolic system, if those aren't getting restored, you can diet and exercise all day and none of it will work because the brain is what needs to restore.
Neck pain, backaches, headaches, fatigue, the list goes on, and you're likely on it. Tired of the broken system and big pharma? We offer logical solutions, teach you to think critically, and empower you to reclaim your health. Welcome to the Unplugged Healthcast with Dr. Kevin Wall.
Good morning. Welcome back to the Unplugged Healthcast. This is Dr. Wall, your host. I hope you had a good night's sleep last night. I wonder if you slept like a baby, up every couple hours, crying, needing a bottle, getting your diaper changed. Never quite understood that phrase. It's kind of funny if you think about it. Today, we are going to talk about sleep issues, sleep disorders. 60 million Americans today dealing with sleep issues. So today, we've got to unplug you from the matrix. The typical answer, Xanax, antidepressants, antihistamines. We have got to get off the madness here, unplug from this system. This stuff is killing you. There is no real solution with those high-level pharmaceuticals. So today, we are going to help you solve this problem. I've got two resources for you. First, I'm going to explain and help you understand, empower you to understand how your body sleeps, why it sleeps, some of the functional parts about sleeping. And then I have brought in an expert because my knowledge is going to come to a quick end at some point and we are not going to leave you hanging. So first thing you have to know, have you ever thought about how your heart knows when to beat? How do your lungs know when to breathe? How does your stomach know how to digest? And how in the heck would your body know how to go to sleep, how long it's supposed to sleep, when it's going to wake up? These are just classic, what we call autonomic functions of your body. Your body is running things whether you know it or not. You thankfully don't have to think about eating and digesting. You don't think about your heart. You don't think about your lungs breathing, and you shouldn't have to think about sleeping. If your body's functioning correctly, it will automatically turn off and usually automatically turn back on when you are ready. So to understand that, here's some basic physiology you probably don't know. You have one system in your body that controls and coordinates every other system. It is called your nervous system. This is your brain, your spinal cord, and all the nerves coming off your brain and your spinal cord to all your cells, your organs, your tissues, your glands. And your brain has this job, and that's to make sure it controls and coordinates all bodily functions. So your heart isn't magically beating on its own. Your lungs aren't magically breathing on their own. Your brain is controlling and coordinating all of these functions, including your sleep. Most people say, well, gosh, my brain and nervous system seem to be fine, but you have really no idea because 85% of your nervous system has no feeling whatsoever. If you irritate, pinch, compress, cause damage to what's called an autonomic nerve. These are the nerves that control your blood vessels, your glands, your organs, your muscles. You will have zero discomfort. It actually doesn't have any pain at all. The only nerves that you actually feel are called your sensory nerves. And there's only 15% of those in your whole body. In fact, all those nerves are on the periphery, kind of like an alarm system in your house. You'd only hook up the wires to the outside of the house, not the inside. The inside nerves are called function nerves. And if you have issues of your functional nervous system, you may not have any pain whatsoever. You will just have functional abnormalities. Sleep is a classic indication of function. And really, it's a great measurement of how healthy you are. If you struggle with sleep, I can tell you there's probably something struggling inside your systems. The first thing you got to know is if your spine is abnormal, if you have a neck problem, you're probably going to have a sleep problem, because those nerves in your neck have a big component relative to you shutting down, turning off, putting your head down and going out. See, I do this and it drives my wife crazy. I put my head down and I'm out in about 2 minutes. She's usually in mid-sentence and I'm over there going. But most of you have trouble falling asleep, staying asleep, waking up energized like you have slept, or ultimately you get up in the middle of the night and can't go back to sleep. Well, to understand this, first thing you got to know is if you don't have a healthy spine, if you have back issues, you have neck issues, you're probably going to deal with sleep issues. Deal with those first. But of course, there are other things going on, and we need to handle the full gamut of possibilities. So for us to do that, I have brought in an expert. Welcome to our show, Lauri Ledley. Lauri, it's great to have you here.
Thank you for having me on.
Hey, to just understand a little bit about Lauri, you are the president, founder of what's called Valley Sleep Center. I want to say sleep centers because I know there's about 8 or 9 of them.
Yeah, there are 9 now.
Okay. You're also a clinical sleep educator, which I want you to explain what the heck that even means, because I think there's more to it than I understand. Then the one I don't want to miss are the last couple of years, you're the creator of what is called the Sleep Well Sunday. It's a media site. It's where people can go to, right?
Yeah.
To find information about how to sleep. So everything they need to know about sleeping, they can probably find somewhere in this place. Is that true?
Yeah, that's true.
You also have 250 employees, medical doctors, PAs, nurse practitioners, respiratory therapists, sleep experts helping you in the clinics in the Valley Sleep Center. So why don't you just fill us in a little bit on your background, how you got here, and even if you will, I want to have you tell the story of maybe kind of how you survived cancer twice. I know that's got to be, there's something more there that we need to know.
Yeah. So I was a respiratory therapist at 18 years old, right out of high school. I tried to go to college, and ASU, 500 people in a class was too much for me. And so I quickly dropped out and found a vocational program for respiratory therapy, is where I met Glenn. So we both became respiratory therapists. And my first job was working in a 150 bed hospital at night. And I was just fascinated because when people sleep, their breathing changes. And so I found that so interesting working at night. And my job was to make sure that everyone was breathing. And so we would have infants born in the middle of the night with maybe not matured lungs. And I would have to be there, on call till the helicopter landed and making sure this tiny infant was breathing. My ventilators, which, a lot of times are older people, when they would fall asleep, their breathing would change and it would mess up my ventilator setting. So I was just fascinated by the physiology of sleep. And so I always wanted to know more about sleep. So my first cancer was in 1992 when I was 26 and pregnant with my youngest son, Connor. And I chose to take chemotherapy while I was pregnant over terminating my pregnancy, and received a perfectly healthy baby.
Wow.
At 34 weeks gestation. And I had no hair and he had a full head of hair. And so you go through something like taking chemotherapy while you're pregnant, and you have the faith of, and you'll do anything. I went back to, I spent 5 years thinking I was going to die from this lymphoma, which was super aggressive. But after 5 years, I didn't. And I had these 3 little kids, and, Glenn and I were working, and we had started doing pulse oximetry on patients at home in 1990. I was fascinated again by the overnight oximetry, which is, the whole world knows what oximetry is now. Thank you, pandemic, because oxygen level is very crucial to all these things that you're talking about. And I could see overnight that these patients' oxygen level was dropping, and doctors and nurse practitioners and PAs were ordering oxygen. And I'm like, well, you can't oxygenate a collapsed airway, right? Oxygen doesn't go anywhere if the airways collapse. So I was suggesting that all these people go to the hospital to get sleep studies. And I kept telling Glenn, we could do this. We could do this. We should open our own sleep center. So after 5 years and I didn't die, I thought, let's do it. So Glenn kept saying, the parachute's not ready. Don't jump. Well, we jumped off the cliff finally in 2002 and opened up our first 2-bed sleep center. and it's grown to what it is today. So I did go back and learn sleep in the hospital. I became a registered polysomnography technologist, RPSGT, which is a really difficult thing to achieve. Back then, only 50% of students that learned on the job passed. We now have an accredited program here in Phoenix for sleep technology. So if anybody out there wants to learn how to be a sleep technologist, there's a KHEP approved school at Gateway Community College. And then my clinical sleep education, that came after. That's a newer program that the American Academy of Sleep Medicine came up with just to help educate the public on sleep.
Okay, well, that really explains all those letters behind your name, because I was wondering myself. Okay, so with the Valley-wide sleep centers and your experience in doing all that stuff, give me your feedback. Hit hard quickly on the adverse effects of all these medications and drugs. And sometimes, sometimes I'm just off. What are your thoughts on all the medications and everyone just going to that Xanax? I just heard something this morning about someone getting on Xanax because it knocks them out. I'm thinking, man, all those medications reduce your body's function, and we're trying to get the bodies to function better. So what are your thoughts on the medications that are out there? Because everybody seems to be on them.
So like you believe the spine is the foundation of all health, I believe that sleep is our number one foundation of all of our health. It is where everything is restored. Our brains, it's basically a battery for all these systems that you spoke about. And like we charge our devices at night, we need to charge our bodies. And the only way to do that is through sleep, quality sleep, the right amount of sleep.
See, but they think they're getting quality sleep because they get knocked out.
Nope. So I will tell you that any drug is an interruption to the brain. So although we manage medication, there are sleep disorders that do require medication. We are not prescribing things like Xanax. Xanax is an anxiolytic. It is used to help calm people down that have anxiety. It is not a sleep aid and should never be used as a sleep aid. And sleep aids should only be used very, very temporarily. I'm not a big fan of using medications to sleep because it does interrupt the brain.
Yeah, and there's other side effects you don't realize. And so you just fix one thing, what you think you're fixing, what you're not, and then you all of a sudden have other issues. And that's just maybe turning the systems back on, because the drug doesn't just automatically stop when you want it to. It's going for hours and builds up in your system. Either way, I'll get off my pedestal on medication. It's a hot point for me because I've seen so much of it and it's such an epidemic. But let's just maybe jump to the chase, because you've seen it now. How many years you've been doing this for the last
30
years? So you have got to see the patterns. Yeah. Let's just go with what's the most common cause that most people are dealing with that they're not sleeping. Let's hit that one first.
So what we see most at Valley Sleep Center is excessive daytime sleepiness. So people might be going to bed at the same time, waking up at the same time, but they still feel tired throughout the day.
Okay.
So if you're experiencing fatigue, or you can't get through the whole day without taking a nap or having more than 1 or 2 caffeinated beverages a day, you could have a sleep disorder. So one of the most popular sleep disorders that we see is sleep disordered breathing. So sleep apnea. All people, as you age, your elasticity in your skin, you lose it. Well, you lose the elasticity in your airway as well. And so women over 50 have the same risk of developing sleep apnea as men by the time we're over 50. And, if you've ever been on a retreat with a bunch of women over 50, I know you've been on retreats with men, they snore, and there's help out there. So what we do through sleep studies, so you can have a sleep study in your home now. Well, a sleep test, right? We only look at a couple of different parameters like oxygen level, heart rate, and airflow. And in a polysomnography, a sleep study where you spend the night, we're looking at 30 different parameters. Like we can see an actual EKG tracing overnight. So you get like that bonus overnight Holter monitor when you get a sleep study. But we look at your brain, your muscle tone, all kinds of things. So we can see any sleep disorder on a polysomnography. A home sleep test is supposed to be used only for sleep apnea, people have a high risk, like if your neck is larger than 18 inches, if you have a high BMI, again, if you're excessively sleepy during the day, you have a family history of sleep apnea. This stuff is hereditary. Those of you who have kids out there, Junior snores, isn't it cute? No, it's not cute. That's a problem. Junior shouldn't snore. Babies should not snore. Kids should not snore. So please, we see pediatrics all the way to
Everyone thinks
adults.
this is just something you do when you get older or
No.
you struggle with when you get older. And I've seen epidemics of lots of health conditions seemingly creeping into our kids. And I know it's relative to the foods these kids are eating and some of the other things, but then they just live with it or don't do anything, but they should get it checked early.
We test hundreds of children at Valley Sleep Center.
Wow.
Yeah, we have pediatric sleep specialists. So we're, you don't have to take your child to the medical center at Phoenix Children's. They're great. In fact, we do a lot of the overflow sleep studies for Phoenix Children's. We have a relationship with them, but you can come right to one of our pediatric sleep specialists and get a consultation. It's that simple. But yeah, we treat infants all the way to geriatrics and important. And if you're struggling or your partner is, nudging you, like you're snoring, you're making noises at night, or if you're just plain feel fatigued, especially women, right? So often we go to our physicians and we say, I feel fatigued, joint pain, muscle pain, I'm tired. And they just automatically start handing out antidepressants.
Yeah.
I really encourage you, if you're a woman out there who feels this way, come see us, get a sleep study, get a home sleep test, something. Let us see what's going on, because sometimes it's a simple thing as wearing CPAP or an oral appliance. And there's options now out there. Some people just have positional sleep apnea, which means, just don't sleep on your back. And we have all kinds of ways that you can sleep positionally.
So I think a lot of people don't do the studies, and I at times think about that. Thankfully, I don't really have any issues, sleep well, don't make much noise, but I wouldn't want to wear one of the CPAPs. So I think that's something you hear often. Is that what this always ends up in? Or as you say, sometimes it's as simple as changing your patterns, changing your habit, changing your sleep?
You can, so it's kind of like what comes first. So I try to tell people, if you're struggling losing weight or you're just struggling, like fix the sleep first, because the rest of it will come later. So if you're not restoring the brain, which restores the cardiovascular system, the metabolic system, if those aren't getting restored, you can diet and exercise all day and none of it will work because the brain is what needs to restore. So fix your sleep first, and then hopefully, lose your weight, build up the muscles around your neck. Maybe you won't need the CPAP. People love CPAP. Think about this. A lot of you won't go to sleep at night without a fan, a ceiling fan. CPAP is simple, like wearing a ceiling fan. And it's not this huge mask. There's little ones. It's like going to sleep with the ocean, waves, because it's cyclic, like your breath. It's not horrible.
So things have changed because I remember a friend of mine years ago, I saw had that thing on there and it was like he was being attacked by an alien. No. So that's not the case anymore. People have, they figured this out a bit.
The masks are so much better and easier to use and less invasive. And you might not feel sexy, but snoring is not sexy either.
Well, let's give them some basic information. I'm curious to your thoughts on, what would be normal sleeping? And I think there's differences as people are at a different age groups. What would you say the normal amount of sleep someone should have, and should it be uninterrupted? And let's start at the younger age. You give me the groups.
All right. So there's different age, children, I'd have to look them up specifically, but if you have small children, they should be sleeping, 10, 12 hours a day, depending on their age, even 14 with naps, right? So get to adolescents, they actually go to sleep later during the day and want to sleep in. Their circadian rhythms are changing, and that's kind of like our biological clock. It's really hard for a teenager to fall asleep probably any earlier than 10. So they're going to need 10 hours of sleep. And then get to adults, when you're an adult, 7 to 9 hours is really what you should get. I know a lot of people out there like, I only get 6 and I do great. Well, I just don't recommend it. I mean, there are a very small percentage of population of people that do 6 hours and they do great, but the American Academy of Sleep Medicine would recommend that you get 7 to 9 hours. of uninterrupted sleep. Now, as you age, you're going to get up to go to the bathroom. That's just normal, especially, if you're having any liquids, after 6 p.m., which most of us, we live in Arizona, have to have, water up until the time we go to bed. I mean, I get up, I drink water in the night, I get thirsty. So these are all normal things, but you want to make sure that you go to bed at the same time, you wake up at the same time, and that you're not feeling tired throughout the day.
We talk about this often, and we've had many of professionals just keep telling you guys this. There's a rhythm to life, and part of that rhythm is getting outside, being active, eating well, and sleeping correctly and sleeping there. So going to bed, same time, waking up, what's the best positions? I can give you my chiropractic opinion, but I'm curious what yours is before I voice in.
Well, I sleep on your back. I mean, I'm a number one fan of sleeping on your back, and, with a pillow that gives you a natural curve in the neck.
So these big pillows you see on all the sitcoms, it just drives me nuts. I can't even watch those shows because these people's heads so jacked up. Yeah. Not only if they don't sleep good, they're going to have a horrible neck problem anyway. So smaller pillows, allowing your neck to fall into a curved position on your back. I would suggest that everyone puts a pillow underneath their knees, because a lot of people have tight hamstrings, hip flexor issues, so they can't sleep on their back. They have to turn sideways, pull their knees up, and then they can sleep. But if you put the pillow underneath there, that seems to help a lot of people. You've seen that too?
Yep. That's my favorite way to
sleep. Is side sleeping an okay thing?
I think it's definitely okay, especially if you have positional sleep apnea where you do snore on your back. So yeah, sleep on your side. But I think the favorite is
still the back, huh?
Mm-hmm. Yeah.
Well, if you are sleeping on your side, I got to give you my opinion on a few things. The pillow height is important. You have to look at the gap between your ear and your shoulder. So if you measured that gap, you'd find that's about 6 to 8 inches. That's maximum. Your pillow can't be more than 6 to 8 inches in thickness if you're sleeping on your side. If it's too small, your head's bent down. If it's too big, your head's bent up. Mm-hmm. And then I like a pillow between your knees, or sometimes a body pillow. And that often will help you sleep better, because if your knees are not together, no one really ever sits with their knees pushed together. So you shouldn't sleep with your knees pushed together. So a pillow between your knees, and often some people like the pressure on their stomach. So I like the body pillow, but then unfortunately they love to sleep on their stomach. I'm going to let you, what's your opinion of stomach sleepers?
Not a fan. I think people who sleep on their stomach are trying to establish airway. You probably have sleep apnea.
Wow. So that's really almost a compensation. Mm-hmm. I always felt that if they had stomach issues or issues, they like pressure on their stomach. That's what they always told me when I was telling them that, first off, it's going to jack your neck up because you're sitting there with your neck twisted all night long. Yeah. And as your mom said, if you hold your face that way, it'll stay that way. Well, I'll tell you, if you hold your neck that way all night long, it's going to stay that way. So you got to get off your stomach, and side is, in my opinion, okay. But if you're having sleep issues, it sounds like your back is where you should be.
Agree. 100%.
Okay. All right. Well, then this continuous sleep issue, I hear often, I wake up in the middle of the night and I can't get back to sleep. Now, is that again a breathing oxygen thing?
It could be. It's important to find out what's causing you to wake up, right? So is it your brain thinking of something that you have to do the next day, or something that happened to you the previous day? I really encourage like bedtime routine. We teach our kids this, but then we don't do it as adults. So basically everyone should have a bedtime routine. Power down hour. So 1 hour before you go to bed, power down all your devices and create some kind of relaxing environment. I recommend a hot shower or a bath. Now, one thing that's really important is a cool, calm environment, because having a cool environment increases melatonin, which is our hormone that helps us fall asleep and stay asleep. Well, the hot shower or bath, you think
hot tub?
Yeah, something, because what happens when you get out, the body cools down quickly, and that helps increase melatonin.
So those are good then.
Those are really good.
So a hot shower.
Infrared, that's a really cool thing now.
You're stealing my thunder,
yeah,
because
that's a big deal.
It is a big deal. I
you
sleep like a baby when I'm doing the infrared
because
sauna.
When you do that, you're focusing on your breath. You're increasing your melatonin when you get out. It's really, really good for your body. I mean,
So you think people are waking up are because they're in bad patterns almost.
Yes.
They're setting their
yeah.
body to wake
Yeah.
up. They don't get to that
Right.
deep state of sleep because they're so heightened before
Yeah.
they get to sleep. Is that what it is?
Yep. And I'm really big into, journaling, meditation, prayer, whatever, works for you. Write down, every day, at least 3 things you're grateful for. Like gratitude is the antidote to anxiety, stress, all these things. If you write down, it will really help you. And then I'm a big believer on just closing your eyes, pray, meditate, but at a minimum, focus on your breath, right? So what is the first thing we do when we come into this earth? We take a breath.
Yeah.
What is the last thing we do when we leave? We take our last breath. Think about all those breaths in between those 2 breaths. They're completely involuntary.
Yeah.
Like you said, they're automatic. We never think about them and we never use our breath. It's so powerful. Your breath has the power to heal your entire body and nobody ever uses it. So these cold plunges and infrared and these extreme, putting your body into these extreme situations are really big right now. But what is the one thing they teach you? Focus on your breath. That's what gets you through the hard things, is focusing on your breath. So if you do find yourself after you've created this bedtime routine, you have a cup of, sleepy time tea. Don't drink alcohol. Alcohol interrupts your sleep. People think alcohol helps them fall asleep. It does not. It interrupts your sleep because even though you might not wake up, it interrupts your brain. Your brain wants more. It can't have it. Your blood sugar drops. It's just all these things. So I really encourage happy hour. If you like a glass of wine, have it early. Don't have it too close to bedtime so it's out of your system. And then of course, excessive amounts are always a bad idea. Get that routine. And then if you're still waking up in the night, immediately go to your breath, right? Or we like to try to teach people cognitive behavioral therapy, which is also just imagining yourself in a place that you love. My happy place was the Australian beach, where at the time when I developed this meditation for myself, I had breast cancer, and my little granddaughters, who are now 12 and 10, Zoe and Millie, were tiny little babies. And I would close my eyes and imagine myself swimming in the ocean as a mermaid and seeing Zoe and Millie as older girls grabbing their surfboards saying, look, there's a mermaid. And then all my other grandkids, which now I have 4, were with them, imagining, and I would fall asleep surfing the waves with Zoe and Millie and my future grandchildren. Now I have 4. So I still use that, which is really, kind of, you might think corny.
I don't think corny at all.
It's beautiful.
I just realized why I do that all the time.
Yeah.
And I think if the listeners are hearing, you just got a tidbit nobody's talking about right there. If you mentally control your thought process and you focus on things like that, things that are, in fact, Philippians, I think 4:8, focus on things that are good, that are joyful, that are not, versus we just go to the problems and then we wonder why we're not sleeping. And we go to the alcohol to forget the problems when we're not sleeping. We go to the medication. Every time you put any of that stuff in your body orally, your body's going to detoxify it out all night long. And so it's never going to be able to rest. You're supposed to shut down, but then you put stuff in your body that your body's going, oh crap, I got to work all night long, it looks like. And I think that's the same with the brain.
Yep.
If you put stuff in your brain that it's got to detoxify, it's doing that all night long.
Do you know what the medical diagnosis of insomnia actually means?
No, I'm excited to hear though.
Oh, this is good. The inability to escape one's thoughts.
Wow.
That's exactly what insomnia is. It's the inability for you to escape your own thoughts. So figure out what it takes to escape your own thoughts and do it. There's a thing. I haven't done this in a long time, but I used to go to hot yoga every day. And I could walk in that yoga room with the weight of the world on my shoulders and walk out and none of it mattered.
Yeah.
None of it mattered. Because I was in extreme environment, focusing on my breath.
I do Pilates now. I hate to admit this because not many men do Pilates.
I think it's great.
But it's the same thing because for that hour, you are focusing on all these very strange,
on
unique
your
breaths and stretches. And all right, well.
You know what Pilates is? Prozac.
Pilates is Prozac?
I call Pilates Prozac.
All right, I'm going to go with it.
I did Pilates for years too. It's great. Some of the depressing times in my life, Pilates was my Prozac.
Well, too many times we're going to the Prozac and we need to consider something that's not just going to just wear out your organs. And I'm telling you, you've got to stop this over medication. We are our own worst enemy. I can throw rocks all day long at Big Pharma, but you're the ones that's consuming it. You got to stop consuming it and they'll stop selling it. So let's just wrap it up. I'm going to go with my top couple things people need to remember as this podcast comes to an end to sleep better. And then I'm going to turn it over to you if you can maybe prioritize the top 2 or 3 things they need to walk away with. And then before we maybe get to that point, though, because just in case they shut us off now, how do they find you? How do they find answers through your entities? Let's go to there, talk about it, and let's plug what you guys are doing and where you're doing it.
ValleySleepCenter.com is our website. You can text 480-830-3900. I'm Lauri Lynn on Instagram, and then Lauri Ledley on Facebook. So follow me. I think my last tips would be this. Don't hit the snooze button. Put your feet on the floor and get light in your eyes when you wake up in the morning. Have only one caffeine drink a day if you can, and go to bed at the same time and wake up at the same time.
Wow. We should probably wrap it up right there. I'm going to still give you my 2 that you don't realize, and I think you'll probably back this up. When you have a high carbohydrate diet, when you are under a lot of toxins and stress factors, you are in inflammation. It isn't just your blood vessels that swell and cause high blood pressure. Your actually air tubes swell. You don't get enough oxygen in, you definitely start snoring. You struggle breathing. So if you can reduce your inflammation with a better diet, you're going to sleep better. So again, that goes back to drinking the alcohol. I know a lot of people think snoring is from weight issues. I know weight is relative, but I think it's diet more than weight, because that high carbohydrate, high alcohol, toxic food, processed food, inflammation, boom, you're done. Do you see that maybe as a possibility?
Sometimes it's just anatomy. It's just people have small airways. It doesn't always have to be a weight problem. So yes. And, exercise, I talked about yoga and Pilates, and my favorite thing now is HIIT and strength training. As I get older, it's really important that you exercise as part of that too. But 100%. Yeah, you gotta keep your bones strong, ladies.
Got to get moving. If you don't move it, you're losing it. So there you go. And the last thing I'll tell you is got to get your neck checked. If your neck's not right, I'm telling you, I have treated so many colicky babies that could never sleep. And soon as I fix their neck, they fall asleep in the room, go home and sleep for 3-4 days. If you're having a neck issue, I don't care if you're a baby, a young adult, or you've been in car accidents and you have neck issues, you're probably going to have sleep issues. It doesn't mean you shouldn't go get a sleep exam, but I would recommend you do both, because I think the number one thing to walk away with is that if you're not sleeping, you're not healing, you're not regenerating, you're not recovering, you're not going to actually have the ability or the energy to fix anything else. So I'm gonna jump on you. I like sleep being the core thing that everyone should do first, foremost, probably above or close to anything more important in your life. So there you go. All right. Well, we're going to wrap this thing up. Again, if you do us a favor and share these podcasts to other people, because we're just out here trying to preach this message and getting people to understand that health is simpler than you think it is, more logical. You don't need a bunch of drugs. You don't need a bunch of chemicals. You can be healthy for a lifetime. It's a lot more fun. I can tell you, you get a lot more done and you have a lot more enjoyment. So share this with others. Check us out on drkevinwall.com. If you want to be a call in the show or you want questions answered, go there, leave us questions, leave us information. We could even bring you in on the show if you want to ask questions to our professionals there. And check out Lauri at the ValleySleepCenter.com. I think that's where it is. No S. Don't put in the centers, even though there's 9 of them, I think. And there are valley-wide and out of the Tucson, and I think you're going to Prescott also.
We are. Prescott.
So check her out. Check us out. And we'll see you again on the next episode of the Unplugged Healthcast. Be healthy. Be blessed. Never give up. Never give in. I'll see you again soon.